What's up, everybody? It's Michelle Renee from iamMichelleRena.com. And today we have my friend, my good friend, Dr. Chaiqua Harris from Counseling Corner with Quia. Quia, can you tell me a little bit about yourself, where you're from, the name of your brand, and just kind of give some information about what it is that you do and why you are here with me in this moment?
Okay, well, I am Chaiqua Harris, originally from a small town in Mississippi, but I currently live near the capital in Mississippi. I guess pretty much every town is small in Mississippi.
We're both from small towns
Yeah,
in
so,
Mississippi.
I am currently employed as a professor at an HBCU. And I am a professor of counselor education.
Yeah.
And I guess Counseling Corner with Quia, I really don't consider it like a brand. It's just something that I started to normalize mental health in the African American community. Like, I feel as if it isn't part of the normal conversation as any other physical ailments that maybe like discuss, like, oh, you'll talk about like, oh girl, my tooth hurt, or oh girl, my eyes hurt, but you won't say, oh girl, my mental health is hurting. I'm depressed. I'm anxious. I possibly need to see a therapist. That's not normal, but what is normal conversation? And so that's why I started doing the Counseling Corner with Quia. I started them on my Instagram page. And then I just said, okay, I have this page locked, so why not make them public in case people want to share it on other avenues. But I honestly don't have any plans to do anything with it. But if someone would want me to talk about mental health, I always can do that. But I do not have it as something that I'm trying to like push for, like, as a brand.
Right. You cover so much just in that intro with how important it is for us to have conversations around mental health. And I think that even having a space to highlight different things, because I've been following Counseling Corner with Quia since you started it, and it has really blown my mind with some of the things that I thought or felt or experienced, and how you brought it to a this is okay. It's okay to feel that way. And it's okay if you're not okay, even after we acknowledge it. And I think that's so critical. How long have you been in this profession? How long have you been doing the work that kind of led you up to saying, you know what, enough is enough. We need to start normalizing mental health and wellness and therapy.
Okay. Well, I got my BA in psychology several, like 20 plus years ago.
But you can't be more than 20 years old, Quia.
Oh, sure. But then, like in 2014, I completed my PhD in counselor education, concentration school counseling. However, before that, I worked as a middle school counselor and a high school counselor. And I've also one summer worked as an adolescent offender therapist. And I have had courses in clinical psychology, counseling psychology. So those were areas that I started out in. And so I feel as if I've been doing, like, pretty much maybe in my own head, I've been doing this for several years, but now as a professor, I'm going into my 6th year as a counselor educator at this specific university. Mm-hmm. However, I have worked 2 other places just for like a year and a half at the other places. So 2 other universities. So I guess in a total, probably about 8 years as a counselor educator, but the Counseling Corner with Quia maybe about a couple of months.
Okay.
But yeah, I've always journaled and had these thoughts in my head. So
absolutely. So kind of think for a second and tell me why you think this is such a critical point for us to address this in the African American Black community, among Black women.
I feel as if, I would have to say that it is because of my introspective. I during this time, I had a lot of points where I became introspective, and I started to explore things and how they were impacting myself. And I thought, well, I'm sure other people are feeling this. So as other researchers have stated, that vulnerability oftentimes opens doors for other people to actually experience the feelings that they are afraid to show. So it allows them to be vulnerable. Once you're vulnerable, you give other people permission to be vulnerable. So it's that self. I mean, you've always talked about mental health and how it is not common in the African American community. So why not put it out there? And so during these social injustices that have occurred, as well as the pandemic, and people are being at home alone, or even at home with people who are not healthy for their mental health, they're having more hours at home with these persons. So I said, okay, yeah, this is definitely a pivotal time, because we all are experiencing something. It may not be the same as far as like emotion, but I'm quite sure that they fall under the same umbrella of mental health challenges. If you do not want to say like issues or disorders, there are things that people are dealing with that need healing, but it isn't normal in their community to be healed from it.
Right, right. So we've seen a lot on social media, different posts and things like that have been shared regarding trauma and healing. And it's like everybody has become a therapist, or everybody has become
Yes.
a counselor or a coach. Everybody wants to share, their best practices of what they believe to be how we cope with things. But what are some things as a professional that you would say people need to do so that in the midst of a pandemic, they can learn how to cope with whatever it is they're dealing with outside of therapy? We know therapy is like the number one thing, but even now we're dealing with therapy, we're doing teletherapy. So we're not really doing any kind of face-to-face or having any major interactions when it comes to that. So what are some other tips for people during this time that can kind of help them with the coping mechanisms that they need so we can get through this thing and be okay?
First step is acknowledging the feelings. Like, we try to suppress, push things back, but you have to allow yourself to say, okay, yes, I feel that. There's no rush to get out of that feeling. So acknowledge it, sit with it, and then explore within yourself, where is this rooted? Is this rooted in this present event, or is this something from a past instance that I've had that is triggering me in this present? And I know that may take a lot of work. So possibly journal a lot about every time you have that feeling. What is occurring when you have that feeling? Who is present when you have that feeling? So journaling, emotional journaling, feelings journaling, making sure that you are aware of, I know it sounds like kindergarten, but it makes you think of like who, what, where, when, and why. Like all of those, let me pay attention to those. So in a way, it's like mindfulness. Like with mindfulness, you're very present and paying attention to what do you hear, what do you smell, what do you feel. So you're becoming more aware with your emotions, because when you are aware of those emotions, now that propels you to, let me take action. Let me take action into figuring out what is occurring. And if I need a mental health therapist to assist me with this, it's totally fine to need that. But you said, as you may not be able to get to one, I would say first keep a journal. Then, I am definitely a spiritual person. So if you need to meditate on whatever word that you believe in, meditate on those things. So I always go back to being present, because a lot of times anxiety stems from thinking about your past or your future. Yeah. So let's stay here and try to figure out
in this moment.
Right, in this moment, what is occurring. So journaling, present, meditation, connecting with your higher spiritual being, as well as having a support system. And a lot of times we don't want to, I don't want to burden people with my issues. I don't want to share. They might say things about me later. But that's when you need to figure out do I need these people in my support system?
Oh,
If you do not feel right, you do not feel safe enough to be soft. That's why a lot of Black women, we do not feel that we are safe to show that softness. So that's why we are oftentimes seen as oh, she tough. Oh, she's mad.
She's a Wonder Woman. She's a Superwoman. She can handle everything. Yeah. And that's such a dangerous narrative.
Very
that
double
is such a dangerous narrative.
Sword. Yeah, very, very tough to be that person because you aren't able to actually be in those feelings. And as I've been reading this book, it's the Unapologetic Guide to Black Mental Health by Dr. Walker. And she talks about where we oftentimes aren't able to show those emotions, but then when you feel like, okay, all Black people strong and I can't show those emotions, then who do I go to? Well, first and foremost, who do I identify with? Because I must not really be like a part of that because I'm feeling weak. So,
so you're what is an imposter syndrome? You feel like you don't belong in this space. You don't even have a place to coexist. Yes, exactly. I think we've all probably experienced that because of that narrative of feeling like, oh, I got to be able to do everything, whether it's being a mom or a student or a daughter or whatever. And the moment you feel like you're under pressure or you can't take it, you're like, okay, so something must be wrong with me because everybody else seems to have it together and I don't.
Right. And unfortunately, a lot of times that, as her book talks about, that can lead people to suicide. Because like I have nobody to talk about it with and nobody can help me rid these pains that I'm experiencing, as well as I don't fit in anyway. I might as well end it all. I'm not a part of anything. No one will miss me. And so oftentimes that it has led to dying by suicide.
Right. That's powerful. We have to be able to create a space for one another to say, hey, sis, you can talk to me. I may not have all the answers, but I can at least listen. I can acknowledge your pain or I can acknowledge your feelings. I'm here. And just be in that place to where you don't have to be the strength. I think you and I were both watching one day an IG Live about the strong friend. And I think at some point we all have identified with some of those qualities of feeling like you have to show up for everybody or you have to be the person. But the reality is you need that person. Somebody has to be that person. You need that person. And sometimes you got to be that person too, right? Exactly. So it's being able to acknowledge whatever role you play in your friendships and being okay with saying, hey, I can't be the strong friend today. I am not doing well. I am not okay. I need somebody to check on me, help me, and being able to ask for that kind of support. I think we have to kind of shift that narrative so people feel more comfortable with saying, you know what, sis, I would have never known that, or I would have never imagined that, but I'm glad to know that you are human. I'm glad to know that you have those feelings and want to be able to share it, because that vulnerability comes with transparency. Right?
Definitely. Yes.
Definitely comes
and you
with it.
Be in a safe space to be transparent.
Absolutely.
As I share with people on my page, like I have been diagnosed with generalized anxiety, just on the lower spectrum. And my current therapist teaches me how to be comfortable in all settings of and when she says comfortable, she's meaning I am aligned with my true self in all settings.
Yeah.
I'm allowing queer to be queer in all settings.
Yeah.
And
that takes some embracing.
Oh yes, definitely. Definitely takes embracing and a lot of work, and you have to sit with you.
Yep.
That was one of the toughest things for me, is to sit in the pain, because I wanted people like, okay, I'm going to fix it and it's going to be done. No, you have to really invest in knowing who you are and being 100% okay with that person, and wanting to work on areas that you want to, and not on areas that other people have told you need to work on.
Listen, when it comes to being able to say that, I talk a lot about affirmations because I'm a words of affirmation person. But I grew up my whole life with other people placing their beliefs of affirmations about me on me. And it took me into going to therapy, into really unpacking the damage that those words did with being a words of affirmation person, and saying, you know what, I'm actually not that. So I'm not going to own that. I know what I am, and I'm going to sit with what I know to be true about myself. So while you may want to label me as mean, the reality is I'm direct and I say exactly what I intend to say. And could I work on a little bit of tact with some things? Absolutely, but mean I am not. So we have to learn how to redefine and I guess like unpack where it is that we are in that place, because sometimes different traumas we've experienced, different growing up or whatever it is, relationships. And when we say relationships, people think automatically that you're thinking about like a sexual boyfriend, girlfriend relationship. No, relationships, every capacity, friendships, teacher, parents, family, whatever it is, those relationships have given you this identity that may or may not be true. And so you have to really search within yourself to say, you know what, that's actually not me at all. When I discover who I am, this is me. And you're so busy seeing this picture that you've drawn of me that you can't even see who I am. And so it's like almost like taking that ownership back. Does that make sense?
Oh yeah, definitely. And what we oftentimes as humans fail to realize that a lot of times situations aren't as they played out, they are how we perceive them. Absolutely. So your reality is totally different from my reality because we have different perceptions of it. So if that's how you perceived it, it's really not my stuff, it's your stuff.
And you got to sit with that.
Yes, exactly. Yes. Right. You're looking through your lens or perception and not my.
We will never truly understand another person's lens if they're not willing to be honest and open with what drew them to that space or that conclusion. Because a lot of the times when people make those assumptions about people or about actions, it has everything to do with something else. It's a trigger. So when you did something, you actually triggered something from something else. And it's like, you got to sit with that and unpack why it is that you received that in that manner, why you believe it to be that way, and all those different things. And it's so hard for people to do that when they're not honest with themselves.
Right.
And it's like, I try not to go and put my perception off on other people, because I grew up knowing how that feels for a person to say, just give you all of their baggage and go, no, but you're going to own this because that's what you are. And I'm like, I'm not going to own that. I'm not caring. I got my own baggage. I'm not going to take on yours too. So I think that takes strength in and of itself to be willing to tell a person or tell a loved one or whatever that, you know, no, I'm not going to accept that. Or you don't get to write my narrative for me. You can write a narrative about me that is yours to own, but you don't get to write this narrative for me and then have or make me own it. I refuse.
Yes.
I refuse. I'm so excited. Thank you so much, Chaiqua. With what I'm going to ask you, this is the last thing I'm going to ask you, is if there's anything else that you feel is important to highlight, because you've covered so much. I know that I watched you on your journey to your doctoral degree, and I know how much work it took you to get there and what you had to put into it. How is it being in the field of, you know, psychology and counselor education as a Black woman? What is your experience with that?
Well, I would say, far as, are you meaning like me getting towards the doctorate? Because, you know, currently I work as the professor, not actually out in the trenches. And so
more so, what is it like? I watched you go through that journey, and we know that part was tough. But once you accomplish that goal and you feel like you're at the mountaintop and it's like, yes, I've got it. Now that you're in this space and you're operating as a professional, doing what you do, how is it navigating this world? Because we know that navigating the world just in general as a Black woman is already difficult. What is it like navigating this particular sector as a Black woman?
Well, I have, along with some other colleagues, I have did research on the Black female who holds a doctorate, looking at ageism, sexism, and racism. Because although I work for an HBCU, unfortunately, you will still experience isms, whether it's ageism or sexism.
Everywhere.
It's right. And so you have persons who don't want to call you doctor, whether it's sexism, because they may not look at a female as being able to hold the caliber that is needed to have a PhD or to be called doctor. You have those who, as I am, I guess a younger professor.
You are a young professor. Like, you would be like one of the cool professors. Oh, that's my homie, Dr. Harris.
Right. So, but some of my students may be older than myself and may not feel as if I have enough knowledge to be able to tell them things. Or that you have sometimes people who have internalized oppression, and so they don't see a Black professor as knowledgeable as they would see a white professor or someone of another ethnicity. Right. So it's like, I've had like questioning my knowledge, but then when they find out that my degrees are from a predominantly white institution, they kind of like, oh, okay. Like, oh, now I'm credible because I went to a white institution. Okay. Yes.
I think we all struggle kind of with navigating that particular narrative. And I think it's I don't know if it's just an education field thing or what, but when they view you or they see you as a Black woman, because that's what we are, that immediate shield comes up on, like, she probably angry. She probably don't really know, or let me see if she even knows her stuff. And you just kind of go like, do you do everybody like this?
They do not.
Just me. And the reality is they actually don't, So I always find that interesting. I like to ask all my interviewees, like, what is one word that affirms you? And that'll be how we close it out. And I want you to give your Twitter handle, your Instagram handle afterwards.
So that Twitter in a long time.
I know, me either.
But go ahead.
What's one word that affirms you? And why?
Transparent.
Tell us why. I know that to be true, but tell the people why that's true. Yeah.
Because I have learned to embrace the vulnerable, hurt, as well as strong person in myself. And I want that to be exuded and shown to others so that they may feel okay in doing so themselves. And it took me a lot of work to get here, but I like to be very directive, honest, and true to who I am in all settings.
And I love every dab of that about you, girl. Yes, I do. Tell us how we can follow you on Instagram. What's your Instagram handle? And when do you post Counseling Corner with Quia?
Okay. Well, it's actually Counseling Corner with Quia. That's the counseling part. If you want to see the stylish professor, that's on another thing where I just do me.
She is a fashionista, y'all. Y'all not even ready, because she is a for real fashionista. I love it.
Well, thank you.
You're welcome.
But I post on Wednesdays, like I post one today. So, but that page is open. The Counseling Corner with Quia page is open. It's public. And so I post them on Wednesdays. And every now and again, I might put something in my story or whatever, but I really post the videos on Wednesdays.
Awesome. Quia, it has been such a pleasure speaking with you this evening. You are such a phenomenal woman. You are a pillar of strength, but you're also a pillar of vulnerability. And I absolutely love that about you. So thank you so much for taking out the time to speak with me and to speak with my hopefully potential viewers. And we just look forward to seeing your platform shared as much as possible, because we want to make sure that every Black woman knows, hey, honey, it's okay to not be okay. All right.
Right. That's what my t-shirt says, but you guys can't see it. But thank you so much for having me. And it takes an amazing woman to see that in another amazing woman and be able to vocalize it. So I greatly appreciate it.
Thank you. I'm a reflection of you, sis. You know that.
Yes.
Right.